Welcome to another episode of You and Me and Multiple Sclerosis. My name is Pam and I've lived with multiple sclerosis for 37 years. And I'm wondering if we're ever going to figure out anything definitive about MS. I don't know. We do seem to have settled on the idea that it's a combination of genetic predisposition and certain environmental triggers, some of which must be related to lifestyle factors. But exactly what those are seems to be open for debate. We do know that MS seems to be increasing around the world, even in places where in the past we didn't expect to find it. One of the things that's being looked at a lot is whether vitamin D supplementation may help with multiple sclerosis, whether low levels of vitamin D might even be one reason why people develop multiple sclerosis. Many clinical trials have been looking at vitamin D in various ways and in various places around the world. I counted 43 different trials that have happened or are taking place through clinicaltrials.gov, and I'll put the link down below so you can take a look at that. But at this point, even the trials that say we have seen a correlation between vitamin D levels and multiple sclerosis incidence or progression have not been able to explain the mechanism by which vitamin D might work. There have been a number of theories proposed, and new trials are being proposed that will look into these exact mechanisms. But like almost everything with multiple sclerosis, there is nothing definitive. One of the things that we've always heard is that vitamin D is related to sun exposure, or at least the best way to get your vitamin D is through sun exposure. And therefore, those of us who live either in northern climates where the sun is not as direct, not as frequent, or we end up wearing long sleeve clothing for much of the year because the climate is colder, tend to develop multiple sclerosis more than people who live in climates where that is not the case. But then I heard recently that the rate of MS is increasing in places like India, which I thought, okay, I thought India had a lot of sunshine and a long warm season, a long sunny season. So I thought, okay, well, what's that all about? But I looked into this a little bit more, and I found this broadcast on the English language version of WION, which is World is One Network, which comes out of India. And very interestingly, even though this is not specific to multiple sclerosis, we learn that just because a place might seem like it ought to be sunny doesn't mean people are really getting a lot of sun exposure.
A 2020 study found that almost 76% of Indians have vitamin D deficiency or vitamin D insufficiency. Why is that? Well, we spoke to some doctors and they pointed at pollution first of all. Higher pollution levels are connected with vitamin D deficiency, and very interestingly, it's the same for clothing. The more clothes you wear, the less you're exposed to the sun, and low exposure to the sun equals to low vitamin D. Also throw in the increasing nocturnal lifestyle, the trend of walking and working out indoors, the trend of spending more time between the four walls of your home or office. Long story short, vitamin D deficiency is a lifestyle problem in India.
But there are a lot of countries that are saying that they're seeing an increase in multiple sclerosis. Places as far-flung as Poland and Bahrain. And here are a couple of the papers that I found. I'll read some portions of those just so that you can get an idea of what they're looking at and what they're concluding. Okay, here's a Pubmed study from 2021. Correlation between vitamin D and alterations in MRI among patients with multiple sclerosis. And this is out of the Department of Neurology, Medical University in Lublin, Poland. And as we scroll through here a little bit, it says that vitamin D has been shown to affect the onset and progression of MS via its immunomodulating properties. The role of vitamin D in MS pathogenesis and treatment deserves further investigation, as there is sufficient evidence to suggest a correlation between vitamin D blood level and brain MRI lesion load. And down here they say vitamin D supplementation among MS patients has been associated with a lower probability of new lesions and loss of existing lesion volume. It says here too that patients with clinically isolated syndrome exhibited an inverse correlation between vitamin D concentration and risk of new lesions, as seen in T2-weighted MRI scans. Moreover, vitamin D intake among these patients lowered the risk of progression to clinically definite multiple sclerosis. So daily intake of vitamin D during certain other treatments like fingolimod or interferon beta strongly correlated with lower numbers of new lesions. According to our authors, their results were that recent findings advocate for the monitoring of vitamin D blood levels in MS patients. Vitamin D supplementation should be considered in both MS patients and patients with clinically isolated syndrome, where other signs of disease may be delayed. Moreover, vitamin D supplementation appears to lower the likelihood of new demyelination changes apparent in MRI examinations. And as you can see, there are similar articles that they've listed here that you also may want to check into. Conversely, here's an article out of Bahrain, Vitamin D for the Management of Multiple Sclerosis, which was conducted by the Department of Pediatrics at the American Mission Hospital in Bahrain. Here are their conclusions. Let's just scroll down to that. To date, very low-quality evidence suggests no benefit of vitamin D for patient-important outcomes among people with MS. Vitamin D appears to have no effect on recurrence of relapse, worsening of disability measured by the Expanded Disability Status Scale, and MRI lesions. Effects on health-related quality of life and fatigue are unclear. Vitamin D3 at the doses and treatment durations used in the included trials appears to be safe, although available data are limited. 7 ongoing studies will likely provide further evidence that can be included in a future update of this review. So there you go, 2 different studies from 2 different institutions in 2 different parts of the world with quite different conclusions. And I give you these 2 examples as just representative of the vast majority of the studies on vitamin D. Some see a lot of promise, and some fail to see promise. As usual, more studies are going to have to happen. Here's the clinicaltrials.gov page. When I searched for multiple sclerosis and vitamin D, I found 43 studies that have either been concluded or ongoing. And as we do a quick scroll through here, we can see that here's one out of Canada, here's one out of Saudi Arabia, here's one out of Iran, Wisconsin, United States, the Netherlands, California, the United States, and Maryland, the United States, Brandenburg, Germany, France, Haifa, Israel, California, United States, the Netherlands, Slovenia, Turku, Finland, more out of France. You get the idea. This is a worldwide investigation into vitamin D. There are actually some that have been completed and the results have even been published. But this is just a way of letting you know that this is not some minor league sort of thing. This is definitely something that investigators have decided bears enough promise that they want to look into this more seriously. It would be lovely if something that's so inexpensive and so readily available would actually help people not get MS or keep it from progressing. That would be great. You might as well try to get your vitamin D levels up to what they call the normal levels, and you can work with your primary care doctor or your neurologist to figure out what that might be. My understanding, at least in the United States, is that the blood test that looks at your vitamin D levels is not covered in the standard blood tests that are done that are covered by insurance. So you might, if you really want to know your vitamin D levels, you might actually have to pay separately for that. And I don't know how expensive that might end up being. Hopefully not too bad. But it would be good to know, and it would be good for us to keep working on that because, like I said, it's a relatively simple therapeutic strategy, right? Might as well. But new research may tell us more, or the mechanism may finally be explained, and that would be great. It would be nice to know something definitive about MS, wouldn't it now? Well, anyway, that's all I really have for you today. It's going to be nice and sunny here, and maybe where you are too. So spend a little time in the sun, but not too much, because you don't want to get sunburn or skin cancer or any of the other hazards of being out in the sun. Strike the balance, right? You take good care of yourself, and I'll see you again in my next video.